practitioner, the MD.
Okay, good afternoon. Many thanks for joining me on the program Healthy Living. I'm yours sincerely, Oluije Oikohai. Today on Healthy Living, we're here together to educate you, to inform you, and of course to get you entertained. And today on Healthy Living, we'll be looking at sexually transmitted disease. Yes, when this topic came on, I was actually thinking to myself, do we still have people that have this in their system or in their body, or have these diseases affecting them day in, day out? So I tried to call Dr. Jolly Guma, and he said yes, it's still very, very prominent in our society. So doing justice to that for us today, educating us on healthy living as far as sexually transmitted disease is concerned, is the person of Dr. Jolly Nosa Iguma. Dr. Jolly, good afternoon.
It's a pleasure. Thank you for having me.
Okay, so Dr. Jolly, I would like, because everybody out there will want to know who you are and what you stand as a doctor.
I'm Dr. Jolly Nosa Iguma, the MD of Jonas Medical Center, a family medicine practitioner.
Okay.
And we are talking about sexually transmitted disease.
Okay. All right, so Dr. Jolly, I want to know the meaning, what it means, and what causes it, the treatment, the diagnosis, and all. But before we dive into that, we want to know what is sexually transmitted disease.
Yes, sexually transmitted disease is an STI, and it's a group of contagious conditions whose principal modes of transmission involve mucous membrane of the penis, the vagina, the cervix, the rectum, the mouth, and the adjacent skin structure. What STD or sexually transmitted disease entails is a communicable disease that is transmitted from one sexual partner to another. There are diseases that are transmitted during involvement in sexual intercourse, and anatomically the area of the body that will be affected by the sexually transmitted disease, as I've said earlier on through the definition, is the penis, the vagina, the vulva, the cervix, the mouth, the pharynx, the rectum, even the adjoining intimate area of the body which are involved during sexual intercourse. It's very common in our environment. Yesterday was Valentine's Day, and people tend to celebrate Valentine's Day in this immoral way. You know, this sexual immorality has been attached to that love day, which is Valentine's Day, and many things have taken place.
True.
So STD is actually a very common symptoms that people will always come down with. World Health Organization reported that sexually transmitted disease is one of the commonest reasons why a patient will visit an hospital. And statistics has it that 340 million cases of STD are reported yearly, of which 170 million cases are caused by Trichomonas vaginalis. 92 million cases caused by Chlamydia trachomatis. 62 million is caused by gonorrhea, and 12 million is caused by syphilis. This is actually a very large number. And these are the reported ones. There are some persons, they contract STI, they manifest the signs and symptoms, and they kept it on their own until it results to complication that will eventually cause a damage to the patient. And this STD is common among, it affects man, it affects woman, it affects all age group, depending on the sexual promiscuity and orientation of the individual concerned. And is very common among the age of 16 to 25, those who are sexually active. You can see that this age group is fall within the range of the adolescent age group.
Yeah.
And these sexually transmitted diseases are caused by microbes. Microorganisms are responsible for sexually transmitted infection, and somebody must harbor it for he or she to be able to transfer it
To the next
to the
person.
sexual partner. And those microbes cannot be seen with the ordinary eye, but with the aid of a microscope. And they include the bacteria, the virus, the parasitic, and maybe the fungi, as the case may be. And if we look at the bacterial causes or the bacterial types of the sexual transmitted disease, we have the gonorrhea, we have the syphilis, we have the chlamydia, we have the lymphogranuloma venereum, we have the chancroid, we have the granuloma inguinale or the donovanosis. All these are the bacterial types of sexual transmitted disease. Those diseases I've just named, they manifest in different form, and we shall be looking at how do they manifest. Other than the bacterial types of the STD, we also have the viral cause. HIV/AIDS is still very much with us. It's an STD, and we have hepatitis, either hepatitis B, C, D. All these are viral form of sexually transmitted disease. Then we have the human papilloma virus. There are different strains of this human papilloma virus, and there's a benign form and there's a malignant form. The benign form is the strain 6 and 11, which cause the wart, genital wart. And the genotype or the strain 16 and 18 is responsible for cancer of the cervix. So cancer of the cervix is also a sexually transmitted disease. Not only that, we have the molluscum contagiosum as also a type of a viral cause of STD. Then the parasitic form, a very common parasitic protozoa that causes sexually transmitted disease is the Trichomonas vaginalis. So if you look at all those microorganisms, they have to be transmitted from one sexual partner to another, thereby causing the manifestation of symptoms. And if not treated on time, it can result to complication that will not do more harm to the patient in concern.
Okay, now, Dr. Jolly, you said it has to be transferred from one person to another for there to be a manifestation of symptoms. So can we say an individual can have STD and not be able to transfer to the next if there is no sexual intercourse?
Yes, that is what we refer to as contact tracing.
Okay.
Somebody has an HIV, for example. HIV is an STD, and if this person is promiscuous, he goes around sleeping around and having intercourse with A, B, C, D. It begins to spread.
True.
But even if Mr. A harbors this infection and is able to keep himself or herself, or use protective measure or a barrier method, the spread will be limited. So sexual transmitted disease will spread through sexual intercourse. It's through sexual intercourse the thing tends to manifest.
Okay.
If we look at sexual transmitted disease, just like as I said earlier, there are many symptoms that we can ascribe to STD. Somebody might come down with genital discharge, either the vaginal discharge or the urethral discharge. For a lady that has vaginal discharge that is caused by gonorrhea or that is caused by Trichomonas vaginalis, this is the infection. This is the organism that is responsible. she is capable of transmitting this infection to her sexual partner.
Okay.
And this her sexual partner also has another sexual partner. In the case of multiple sexual partner,
Yes.
you can see that the thing tends to,
Go around.
yes, there might be a community spread as such. For example, I've already said something about the symptom of genital discharge,
Yes.
which could be vaginal discharge in women or urethral discharge in men. The commonest cause of discharge in women is candidiasis. Though candidiasis is not an STD,
Okay.
what I'm trying to say is that it cannot be transmitted to a sexual partner,
Okay.
but because of the lifestyle of the woman, she can begin to experience discharge. And this discharge that is caused by candidiasis, Candida albicans, or Candida glabrata, Candida tropicalis, or cruzi, as the case may be.
Okay.
It is not something that she contracted from a sexual partner, as the case may be. Either this woman is on steroid, she's diabetic, or she's taking immunosuppressant drugs, or maybe she's taking high dose of antibiotics, which is capable of affecting the normal flora of the vagina. The pH of the female genital tract, the vagina, is 3.5 to 4.5. So if the pH falls below 4.5, as the case may be, that might cause colonization of this Candida albicans or other strains of it, thereby resulting to white cordy discharge.
Okay. Can you
However,
mention- Okay.
However, there are
Sincere apologies for that break. If you just joined us, this is Heather Living, and we're looking at sexually transmitted diseases. Okay, now, Dr. Jolly, you were talking about the candidal infections and all of that. I wanted to ask now, apart from those persons that you said may be diabetic and all of that, can infection also cause it? You have infection and you're not within the age of the classes within those persons that have what we'll call these elderly persons, or those that have these other infections you talked about.
I'm trying to make it clear that
Okay.
genital discharge, which is the commonest symptom of an STD,
Yes.
not all
All of them are
are transmitted from one person to another.
Okay. Okay.
Some ladies get worried about vaginal discharge,
Yes.
even if they hide under that umbrella of toilet infection.
Yeah.
The candidiasis cannot be transmitted from one person
To
to another.
another.
The
Okay.
lifestyle of the woman might make her to be having this purulent discharge,
Yeah.
which is itching, but not offensive, as the case may be.
Okay.
That is why I said that even if she has vaginal discharge, it
Yeah.
might not actually be that she contracted it from her male partner, as the case may be. Another type is the bacterial vaginosis.
Okay.
It's an infection, but not sexually transmitted disease. And it's acquired through gynecological procedure, maybe because of excessive vaginal examination during childbirth or during illegal termination of pregnancy, either instrumentation or through use of abortifacient medication. That will now cause colonization of Gardnerella vaginalis or Mycoplasma hominis, which will now colonize the lining of the vagina because of the increase in pH, thereby resulting to fishy smelling, offensive vaginal discharge. The woman might come down with offensive vaginal discharge,
Yeah.
but it's not sexually transmitted or acquired, as the case may be. But a woman that is having green offensive vaginal discharge, it might be as a result of Trichomonas vaginalis, which is sexually transmitted.
Okay.
So I'm trying to say that not all vaginal discharge are caused by sexually transmitted infection.
Okay. Right.
Some of them might just be other risk factor. So sexual discharge in women that are sexually transmitted include the Trichomonas vaginalis, and this comes down with green offensive discharge.
Okay.
And for men can also have urethral discharge. That means they see pus coming out from their urethra where they urinate from the external urethral orifice. And this pus might be very painful. And the example of the STI that are responsible for this includes gonorrhea, chlamydia, as the case may be. Other than the discharge, they might also come down with itching, genital itching. The genital itching might just be surface, as in the pubic hair in the male or in the female, as the case may be. Lice, Phytirus pubis, can be transmitted during sexual intercourse. Just common hair lice.
Yeah.
Even the Sarcoptes scabies, form of scabies, they can also be transmitted. These are my results to the genital itching, as the case may be.
Okay.
Not only that, other than these ectoparasites which are transmitted during sexual intercourse, candidiasis too can cause itching, genital itching. But that is not to say that the candidiasis is transmitted from one person to another. Other than the itching, we can also have ulcer, in form of an injury, or a blister in the genital organ, either in the cervix of the woman, either in the labia minora majora, as the case may be, the area of the vagina, or even the penis too. They can just have a sore there, and this sore might just be painless. And this painless sore can be attributed to be caused by syphilis. And they may also be as a result of other bacteria like the Lymphogranuloma venereum or the Granuloma inguinale, or even the chancroid, as the case may be. But in all these that I've said, you need a doctor to be able to analyze it, to tell you exactly the type of STD that you have contracted.
Yes.
So a person might also come down with a lump, a genital lump. And the genital lump might just something like a vesicopapular, lump, kind of, you see something just growing in your genital area. That could be a wart. It could also be a mollusco contagiosum. But it takes a doctor to inspect this and know the diagnosis, and at the end know the right treatment to give to you. So the presenting symptom of the STD are painful urination, urethral discharge, ulcer or injury in the genital tract, genital itching, then the genital lump.
Okay.
So these are the symptoms that a patient with STD will manifest.
Okay, so it doesn't really matter which of them.
Yes, a patient that has syphilis will come down with ulcer,
Okay.
form of an injury in the genital area.
Okay.
A patient with a wart will come down with a lump
Okay.
in the genital area.
Okay.
A patient with gonorrhea or chlamydia will come down with painful urination
Yes.
or a purulent discharge from the urethra.
Okay.
But the truth of the matter is that for women, most STI are just asymptomatic, but they are capable of transmitting the infection. 80% of women with gonorrhea, they might not even manifest. They see, normal discharge as, a normal physiological process, usually in women. So even if they have gonorrhea or they have chlamydia, they will end up transmitting it to their sexual partner
Okay.
until the gonorrhea or the chlamydia will now result to other gynecological complications like pelvic inflammatory disease, that is, the infection has now ascended from the vagina down to the upper reproductive tract, either causing cervicitis, when it affects the cervix, or cause saprophygitis when they affect the fallopian tube, or cause endometritis, as the case may be. And the long-term complication of a patient with pelvic inflammatory disease in women is that it may result to scarring of the fallopian tube. And when there's a scarring of the fallopian tube, it therefore means that this woman is capable of having ectopic pregnancy if she gets pregnant. Or there might be blockage of the fallopian tube, either or both. In that case, she may not be able to get pregnant again as a complication of even an STD like the gonorrhea or the chlamydia, as the case may be. Because I've just said that 80% of women harbor this infection. Unlike in the male counterpart. A male that has or that contracted this gonorrhea or chlamydia, they will come down with painful urination, purulent urethral discharge. But this might not be so in women. 80% will not manifest the symptom. Instead, they will keep on, transmitting it, spreading it, until in their whole body it stays for a long time and complications start coming up.
Okay. You talked about mouth earlier on when you were explaining. Since we're talking about sexually transmitted disease, how can the mouth include one getting infected with this disease?
Yes, that is where we come to sexual orientation.
Okay.
Some persons are homosexual. Others are heterosexual. Heterosexual, man and woman. And it also depends on the sexual preference, as the case may be. Some persons do anal sex, fellatio and cunnilingus, using their mouth for sex. So for somebody that has a gonorrhea, it's possible for you to contract gonorrhea through your mouth. In that case, the gonorrhea will not affect the pharynx, causing pharyngitis for people that are involved in oral sex. Not only that, even the rectum too, that is the anus, can also be involved. Somebody can also contract gonorrhea through the anus when there is an anal sex, other than the mouth sex that I've just explained about. So it depends on the organ that are involved during sexual intercourse. That will now also determine the part of the body where the symptom will be manifested.
Okay. So how can a woman detect that she has STD? Especially with the fact that you said when she has STD and she doesn't know about it, it tends to damage her fallopian tube. So how can a woman know that she has STD in order to prevent these things from happening?
Vaginal discharge should not be taken lightly. Okay. Even when some vaginal discharge are not due to STI, as I've said earlier. Candidiasis, bacterial vaginosis. Even the bacterial vaginosis that is not an STI is very dangerous. It can result to early miscarriage.
Okay.
Usually the second trimester miscarriage for a woman. In that case, the woman begins to experience yellow vaginal discharge, genital itching, maybe painful sexual intercourse. So when a woman experiences genital itching, painful menstruation, intermenstrual bleeding, you bleed in between periods, or you have painful urination, as the case may be, there's a need for you to come for STI screening to avoid those complications that I've just said about.
Okay.
Because the symptom might not be manifested or might not be as severe as that of me. And also, when you notice an abrasion or a form of an injury in any part of your genitalia, or maybe a growth there, it's not something that you just have to neglect. For as much as it's a lady that is sexually active and that does not also imbibe or keep to use of contraceptive, usually the barrier method. So there's a need for you to see your doctor to know the reason for this change in system. And should not see genital discharge or vaginal discharge to be normal until proven otherwise.
Okay.
Or see painful urination or painful intercourse to be normal until proven otherwise. So when you do all those things, you are automatically averting the complication that might come up.
Okay. Okay, so can poor lifestyle result to STD?
Yes, depending on the lifestyle you are talking about, somebody that is sexually promiscuous and somebody that does not have, does not keep to one sexual partner. So lifestyle have a way of affecting, of increasing sexual transmitted disease, as the case may be. And not only that, there's a need for us to also distinguish between UTI from normal sexual transmitted disease in women. Because women hide under this umbrella of toilet infection than actually believe that they have sexual transmitted disease.
Yeah.
And the reason why the commonest way STD are manifested in women are genital discharge. Even if all genital discharge are not as a result of
sexually transmitted disease. Yes.
Poor hygiene. Some women after defecation or when they go to toilet, instead of doing forward, backward, they do backward, forward.
Okay.
Thereby carrying microbes from the anal region down to the genitalia.
Okay.
There are some microbes. They are normal. Their normal site is the anal region. But when those microorganisms leave the anal region down to the genital, the vagina, as the case may be, they become a problem.
Okay.
They cannot result to that bacterial vaginosis or even the candidiasis, as the case may be.
Right.
Though these are not sexually transmitted diseases. But in that case, the woman begin to experience genital discharge. So all these, that still point towards that your lifestyle that you're talking about.
Yes.
Poor hygiene.
Okay. All right. If you just joined us, this is Heather Living with yours sincerely, Oluije Uikokai. We're looking at sexually transmitted disease. If you think it doesn't happen to you or you are safe, your neighbor might not be safe. Your friends might not be safe. Your brother, your sisters might not be safe. So why don't you call them to listen on, as we're here for you to actually educate you. As you can see, I'm holding a pen and paper down, writing all that Dr. Jolinosa Iguma is telling us today on Healthy Living. Let's go for a short break, and when we'll come back, we'll have more discussions on STD. And sure, the numbers for you to call will be on your screen. So don't go anywhere. Don't touch the dial. All right, welcome back. This is Healthy Living with yours sincerely, Oluije Uikokai, and I'm still here with Dr. Jolinosa Iguma. All right, the clip you just listened to just now, you just watched, yes, not Fulani headsmen, but headsmen, okay? So if you're anywhere, just know it's not Fulani headsmen, but headsmen. All right, so Dr. Jolinosa Iguma, in all this you have made mention of the different types of STDs that we have in our society that we get in contact with. What are the most commonest of them all?
Yes, the commonest one in our environment is the bacteria-acquired sexual transmitted disease. Okay. That is gonorrhea. Gonorrhea is very common in our environment, for the reason be that it has a very short incubation period. That is, from the time of exposure to the time of manifestation of the disease. Maybe you had an intimate contact with somebody last night, and after, within a week of that sexual intercourse, you are now experiencing painful urination or a purulent discharge. It's most likely to be a gonorrhea, but it's proven otherwise. So gonorrhea is a very common STD in our environment, caused by Neisseria gonorrhea.
Okay.
And as common as gonorrhea, as I've said earlier, it causes urethral discharge in man. It causes vaginal discharge in women, though 80% might be asymptomatic. A woman can harbor gonorrhea for a very long time. She might not manifest the symptom. Even if she manifests the symptom by, purulent discharge, she might see it as a normal discharge, thereby keep on transmitting it to her sexual partner, especially if she's a commercial sex worker. Gonorrhea as the STD, some of them might even resolve, as in the symptom might resolve on its own, thereby causing complication. It's possible for a woman, as common as gonorrhea, it's possible for a woman to transmit gonorrhea to her newborn baby through the touch. If a woman suffers gonorrhea, definitely the woman, bathes and her hand come in contact with her genital. So these are genital might carry pathogens from her genital tract through the process of trying to touch the baby. At that early stage, she might end up transmitting that gonorrhea to the newborn baby through the neonatal age. In that case, the baby will now suffer what we call the gonococcal ophthalmia neonatorium. She will now have what we call the conjunctivitis. The eye becomes sore at that early stage of life for a woman who just gave birth. Okay. Other than that, it's still possible for a woman who suffered gonorrhea to have complications. We should not even to go far. Gonorrhea can result to fibrosis. I spoke about fallopian tube scarring.
Yes.
Some time ago.
Yeah.
It can result to infertility in women, gonorrhea, because it can affect the fallopian tube, causing it to become fibrous or swell, what we call hydrosalpinx, thereby impeding fertilization from taking place. So that woman become infertile, except she goes for other form of assisted conception, as the case may be. Just common gonorrhea can cause those complications. Even in May, the gonorrhea, if not treated on time, can affect the testes. What we refer to as epididymocarditis. And if this happens, it therefore means that the man will now have what we call the low sperm count or azoospermia. You can see how infection can result to infertility in man and woman, as common as gonorrhea.
Okay. All right, Dr. Jolly, even as we're talking about the complications that can result from STD, now you can call the numbers on your screen for you to be able to ask your doctor any question. Yes, Dr. Jolly Nusa Iguma, any question you want to ask him as far as sexually transmitted disease is concerned. Now, apart from the women having to maybe have miscarriage and all of that, now can we say, apart from that, is there any other ailment that can result from STD?
Yes, like the pelvic inflammatory disease in women, and this might be very troublesome considering the fact that some women will complain of lower abdominal pain, chronic pelvic pain, and this chronic pelvic pain might be as a result of STD she once contracted that was not treated, either gonorrhea or chlamydia. After some time, there will now be complication of this painful intercourse, what we call dyspareunia, intermenstrual bleeding, lower abdominal pain, because of the pelvic inflammatory disease that has occurred due to the gonorrhea or chlamydia she once contracted.
Okay.
So you can see that STD, if not well treated, it can result to complication, which will be more harmful.
All right. Okay. Dr. Jolly, hold on a bit. Hello. Good afternoon. What's your name and where are you calling us from?
My name is Harry. I'm calling from Lagos.
Okay.
Yes. I'm listening to the doctor about the gonorrhea infection.
Yeah, sexually transmitted disease.
About a woman, like man, who has suffered from gonorrhea for a long time. What effect? How does it affect the man? For example, the man, he said will be having some movement of maybe worm, maybe disease going around his scrotum. How can they treat it?
Okay, Dr. Jolly.
Yes, like the question you just asked, there is what we refer to as a disseminated gonorrhea infection.
Okay.
These are long-term complications of the gonorrhea. Just like a man contracted gonorrhea,
And you don't treat it.
it was not treated. And I've said that some of them have what we call self-limiting effect. You are urinating, you now feel purulent discharge, painful discharge. After some time, it goes on its own. But now causing urethritis, it can result to urethral stricture. With time, you are unable to even urinate, as the case may be. And disseminated gonorrhea infection, what it means is that the person might have what we call sexually acquired reactive arthropathy. The person might begin to have asymmetrical joint weakness, in form of an arthritis. Gonorrhea is capable of causing that. Not only that, gonorrhea complication can also manifest as, if you look at the if we are to look at the pathophysiology of the gonorrhea infection, it tends to when it enters into the system, into the genital tract, fluid are released as a way of combating it. The fluid released and the necessary gonorrhea itself tends to form a rump, and this rump can flow towards the appendix area, causing what we call the periappendicitis. Therefore, it's possible for gonorrhea to mimic pain of appendicitis, what we call Fish-Oshkosh syndrome. It's also possible for gonorrhea to the fluid to also gravitate towards the liver, causing what we call perihepatitis. Even somebody that has gonorrhea as a complication, because of the pain, it may also be mistaken to be a cholecystitis, a form of an inflammation of the gallbladder or the liver, as the case may be, arising from the complication of the gonorrhea.
Okay.
So, like what the man just said, it depends on the manifestation. Like the one he said that whether it's warm, like that might be a peripheral neuropathy.
Okay.
But however, I advise you to see your doctor for proper examination to know exactly what that is.
Okay. So, hello? Hello? Okay, so Doctor, who is at risk of STD? Can we say the man or the woman is more at risk?
The man, the woman, both are at risk of an STD.
Okay.
That is the reason why one have to be conscious, play safe, have a trusted sexual partner, use contraceptive, barrier method, whether the condom for man, diaphragm, or cervical cap for woman, the case may be.
Right.
Both are at risk.
Hello?
I've talked about the complication in man, complication in woman as well.
Yes. Okay, so both of them are at risk. Now, can we also say that for the younger ones, hello? Hello, good afternoon. What's your name and where are you calling
Good
from?
afternoon.
Yes, what's your name and where are you calling us from?
George from Benin.
All right, go ahead.
From Benin. Please, I want to get some things right. When I enjoy your lecture, there's somebody just few weeks ago was telling me some experience he has from her vagina. He has just had some growth, and he said that they are went to surgery and cut it, and the thing now come up again. What might be the cause of such thing, and what will she do?
Yes, I mentioned earlier on that manifestation or symptom of sexual disease.
Yes.
I'm not talking about genital lump.
Yes, yes.
So, like the one she's explained that it's a genital lump, and the differential diagnosis, what that means is that the most likely what that lump could be is warts. Because that warts, we can do surgical excision. We can either cut it, or we use some drugs that I cannot mention.
Sure.
To treat it as the case. It's an STD, and it could be a wart caused by human papilloma virus, the benign form I spoke about, which is the 6 and 11. And the problem is, even when there's an excision, or after cutting it, it tends to reappear. Most especially when an oral medication was not taken that will clear it, from the system, or if the sexual partner has not been treated.
So both parties has to be
yes,
treated.
exactly. To prevent reinfection, because that is what this caller is worried about.
Yes.
That somebody came down, the thing was cut off, and something is reappearing.
Back again.
Exactly. So the sexual partner must be treated, and if possible, there must be an oral medication.
All right. Okay. So Dr. Jolly, what are the diagnoses?
Yes, the diagnoses are usually based on inspection and the symptom
You portray.
Manifested.
Hello. Good afternoon. Your name and where are you calling us from?
Joshua, and I'm calling from Benin.
All right.
So I have a friend. She went for test. So the test results showed that she had staphylococcus growth.
Okay.
After some time, she went back again, and the results yielded albicans, cardiac, something like that.
Okay, we can hear you.
Okay. So I want to know what happened. If you people can tell me what really happened. Why did the result not show staphylococcus growth again?
Well, it's very unfortunate, let me say at this juncture, that during my course of talking about the various types of sexually transmitted diseases, I didn't mention about staphylococcus.
No.
Staphylococcus is not an STI. Staphylococcus aureus is a bacteria. Staphylococcus apophyticus is also a bacteria. Staphylococcus apophyticus will cause urinary tract infection. Staphylococcus aureus will cause boil. And while I was defining STD, I said there are a group of contagious conditions whose principal mode of transmission involve soft mucous membrane, involving intimate sexual contact of the penis, the vagina, the vulva, the cervix, the rectum, the anus, the pharynx, and the adjacent skin area. So that is to say that if in the adjacent skin area there are buoy there, it therefore open that area for penetration of an STI.
Okay.
That is also that staphylococcus that you hear around when even those our other brothers,
Yes.
those traditional,
Go about.
yes, saying staphylococcus. Staphylococcus will just cause boil. And many a times, even in your skin, if it's not well swabbed before you do a vaginal, before you do another vaginal swab, if that area is not well clean and you just take it there, it's possible for them to say for them to see staphylococcus in there, because staphylococcus in our skin might even be a normal flora on the skin surface. But by the time this normal flora now, the Staphylococcus aureus now find its way, or Staphylococcus epidermidis will now find its way inside the blood, or find its way inside its genitalia, it becomes a problem there. Okay. Therefore, it can be harvested.
Okay, now the caller said the first results showed Staphylococcus, while the second one
shows Candida albicans.
Yes.
The Candida albicans is actually the cause of the vaginal discharge.
Okay.
I'm very sure that lady suffers genital itching or genital discharge. Okay. That was why she went for the test. Right. The Candida albicans could be is the one that is responsible for the itching and the discharge. And I said earlier on that candidiasis is not sexually transmitted. Yes. It is based on the hygienic state of the individual.
The lifestyle.
The lifestyle of the individual.
Okay, now quickly now, how can this be prevented?
That is the enlightenment.
Yes.
That this television have set up. The need for education and reorientation for people to know that there's a need for them to play safe and have one sexual partner, and if possible use a barrier method. Yesterday was Valentine's Day. Many things would have taken place. Valentine has now been turned to a social cacophony where immorality and other form of things not take place. And I bet you that days and weeks from now, there are going to be manifestations of exactly the symptoms of this STD that I've just explained. So there's a need for one to have one sexual partner, understand the fact that sexual transmitted disease does not just occur, but it occurs when there is an intimate sexual intercourse from one partner to another.
All right, it has been sexually transmitted disease with Dr. Nusa Iguma. And we say very big thank you for taking our time to come educate us today as far as sexually transmitted disease is concerned. He's saying, stay safe, one sex partner. That is what he's saying. So if you find yourself getting involved with any of these things he has made mention of, just get yourself quickly to the nearest hospital, yes, and you get yourself treated. So we'll be seeing you again next week for another exciting time on Healthy Living. Do have yourself a blessed day and stay healthy. Bye for now.
This is ITV.
Hi, this is Anto, and keep watching ITV.
Certainly the best.
Garden of Faith Christian Assembly International Incorporated, Goshen City presents My Own Wedding Must Hold This Year International 2021 48th edition. Dates: Sunday 14th February 2021. Time 12 noon to 3 p.m. Venue: Kilometer 10 Upper Ekewon Road after Uhola Junction, the next junction, Edo State, Nigeria. Host: Pastor Armstrong Ewa. For seat reservation, call the following numbers: 0803 521 5355 or 0807 3923 134. This program is powered by Garden of Faith Christian Assembly International Incorporated, Goshen City.
Drinking my table water.
Water is a must drink for everybody, and one water that readily comes to mind because it is in its purest form is Emark Table Water. After so much of the job, you need Emark Table Water. Are you that lady on the go and have given so much to the weather? You need to replenish with Emark Table Water.
Emark nice water.
For every meal, you need water, and Emark Table Water comes handy. Little Wonder restaurants, eateries, and homes rely on Emark Water to address their taste demands. Emark Table Water, a product of Emark Water International Production Limited. We are all